We are continuing with our topic, asthma. We are seeing asthma part 2. We have seen part 1, we answered the definition. We have seen causes, risk factors. Now we are going to answer question of how to diagnose it, the question of how to know the complications, and the question of how to treat and how to prevent. Okay, so when we start on the diagnosis of asthma, normally you have to start with the family history. The family history will tell you whether this patient might be having asthma or not, because we saw in the part 1 that asthma is a genetic condition. Then we check signs and symptoms, where the patient most of times will be having a cough, wheezing, chest tightness, and shortness of breath. Not only that, but also the patient will be having tachycardia, which is more than 110 beats per minute. That's a heartbeat. Then the patient will have tachypnea, respiration rate, which is above 25 per minute. Then peak expiratory flow rate might be less than 50% of the normal value. Then the patient might not be able to complete a sentence, depending on the severity of asthma. You see, when you check with the peak expiratory flow rate with a peak flow meter, you can see that the patient is not able to exhale out enough air like a normal person. So it will be less than 50%. The patient blow out hard and fast, so he will not be able to reach 50% like a normal person. Then the patient will be very weak, excessive fatigue, hyperexpansion of the lungs, the chest, because the air is trapped inside, increase the nasal secretions. The patient might develop polyps in the nostrils. Atopic dermatitis, eczema, and other allergic skin conditions might start because of immune system is increasing in numbers, and the soldiers of the body are fighting the allergens that are attacking the body. And another thing is, in case of severe attack, the patient will be agitated, cyanotic, becoming blue, hinged forward, trying to catch air to breathe, because the patient will be in breathlessness condition. The peak flow rate will be less than 50% of normal, as we saw. The patient will be speaking just a few words. Speaking in words because they cannot complete a sentence. Then, if it becomes more serious, loss of consciousness might lead even to respiratory failure, even death. So there are 7 signs that one can remember with a mnemonic word, which is shocked, which will be a silent chest, hypotension, cyanosis, and 1/3 of predicted value on peak expiratory flow rate, coma, exhaustion, and dysrhythmias. Dysrhythmias is the abnormal function of the heart, where there is abnormal rhythm. We need to remember that asthma has classifications. There is a class step 1, step 2, step 3, and step 4, where step 1 is just intermittent, 2 mild persistent, moderate persistent, 3 and severe persistent. So each class will be having different symptoms. These are the day symptoms and these are the night symptoms. Like this on the intermittent one, the patient will be having like one attack, asthmatic attack, just less than once in a week. Then when you check per night, this was a day symptoms, but at night the patient might have less than 2 attacks in a month. That will be a mild. And when you check the peak expiratory flow rate, it will be above 80%. If you compare this with the severe persistent, you can see that it's continuous. On daily basis, the patient will be having asthmatic attack. And night symptoms, they will be frequent. And the peak expiratory flow rate will be less than 60%. Remember, on the peak flow meter. Then when you take blood, you might find abnormalities in the blood. Maybe anemia. You can also find eosinophilia. the blood cells, and you can check with a peak flow meter as we saw. Then you take UNEs to check if the kidneys are functioning well. Then you do X-ray and check how are the lungs, are there other abnormalities in the chest. You can do sputum culture to check, rule out if there is no TB. You can do also blood culture to rule out other systemic infections. You see, this is a very important tool to use when you're assessing asthma. Then this advanced one, spirometry, where you have to examine the capacity of the lung of the patient using even a computer. You record, then you interpret the result. Chest X-ray will show hyperinflation of the lungs. You can see the lungs are really hyperinflated because the air gets trapped inside, does not go out because of inflammation of the airways. Then the air gets trapped inside. The blood you take, you go examine what might be the underlying causes. Then you can also take the sputum on the microscope and check different bacteria that might be hiding behind asthma. What are the complications of asthma? Now, apart from infections like pneumonia, which is common, the infection will come and start destroying the functional part of the lungs, alveoli. You can see this middle lobe is getting infected, and you can see also on chest X-ray how it would look like. The part which is fine is black, but this one is getting white on a chest X-ray. Another serious complication is where the normal tube, the bronchi, which has been normal, when asthmatic attack comes, to get inflamed and get swollen to this level, almost closing. It's very difficult to breathe when it is closing. The patient will be coughing, mucus will be a lot getting produced. Then the patient will be with a shortness of breath. Patient might need intubation, respiratory assistance, because if there is a respiratory failure, eventually you need to intubate the patient. You put a tube, you connect on a ventilator, a machine that will help the patient to breathe in. You see, this is a very serious complication where the respiratory failure can end the patient into an intensive care unit, ICU. If no management, you are far from the hospital, the death can take place, which is very sad. How do we treat asthma? To treat asthma, you need to work on the modifiable factors, and you need to work on the medication. Lifestyle modification is important, but medication as well. High flow oxygen is important in the emergency room. You give hydrocortisone, which is a very strong anti-inflammatory medication. You can nebulize with a beta-2 agonist. You can use ipratropium nebulization, and you can prednisolone as well. It's a good anti-inflammatory medication. It's a steroid. The sedatives are not needed in these instances. So, in managing the patient using medication, there is a quick relief, the one you do for emergency conditions, but there is a long-term control that you will take, the patient will take home with, and treatment should always go according to the classifications as we saw them if you want a good outcome. Education is very important. The patient needed to know, the patients need to know how to use the pumps that you have given. Training is very important. And then explain how to take medication accordingly. Then, environmental factors. We have seen different factors. They need to be controlled accordingly. Now, we need to remember that medications that are given are into classes as well. These medications are given according to asthma severity. We saw the mild one. The mild one can just give short-acting beta agonist, which is a pump. You pump as needed. You don't need to use it on a daily basis. But as the asthma becoming more severe, then you can be adding new medication. Like here you can use a corticosteroid inhaler. Corticosteroid inhaler in addition to short-acting beta agonist. As they become more severe, then you can add medications until you can even go to the oral medication to swallow. If it is very severe, then like in emergency situation, patient might even need intubation for helping on this emergency situation. Or it's about helping in getting the airway opened again, because it was blocking, it was closing, that would risk to take the life of a patient. The functional unity of the lung, alveoli, will suffer more if nothing is done. What happens if the bronchi are swollen, closed? It means the blood that's coming from the heart to get oxygen will never get oxygen. So the blood that is going back to the system is not oxygenated. So it will affect the whole body end of the day. So the patient need to be assisted as soon as possible. We need to reduce exposure to mold. We saw these risk factors, the cockroaches, the impact they have on asthmatic people. Then you need to reduce exposure to pets. Pets which are not good for people who are asthmatic once they have pets in their houses. Smoking is a very dangerous factor, not only to asthmatic people, but also people who are not asthmatic. Cigarette is very dangerous. We need to know. It is even written that it is harmful. It is written on the box of each cigarette that you will see. Thank you so much. We will continue with our topics: health education, health promotion, and more topics. More topics, we'll find them on our website. We thank you very much.